Hi, everybody. This is Dr. Kogan, GW Center for Integrative Medicine. Welcome to yet another brief clinical review. So today I'm going to talk about integrative approaches to osteoporosis. This topic comes up all the time. Those of you who've been following my work know that as a geriatrician, I take care of a lot of patients with osteoporosis. It's kind of a bread and butter of geriatrics. And over the years, I formed my own protocols, and also at the clinic, there are several other providers who see lots of patients with this condition. So it's a very common problem. Unfortunately, it's also a very bad problem, because if you think about this, it's a silent condition. If you don't look for osteoporosis, you're not going to find it, because there's no necessarily symptom leading up to it until you get a fracture. And then the problem is that the total collective amount of suffering from osteoporosis is actually extremely high. The quality of life decrease as a result of osteoporosis, it's only behind top 5 chronic diseases such as cancers, heart disease, Alzheimer's, Parkinson's, and COPD, and all other conditions, like even common diseases like asthma, for example. The osteoporosis causes significantly more problems for quality of life in patients who get it. So I felt it's really important to cover this topic. What I'm going to do is I'm going to go ahead and share my screen. There are a couple of slides, and then I'm also going to, through the sharing of the screen, I'm also going to show you some of this more additional specifics that I tend to use in the practice. All right, so we are having a little bit of a technical difficulties. Hopefully they'll play themselves out. So let's do the actual PowerPoint. So, and this is information that you can find also in my textbook on integrative medicine, and also in an upcoming book on general public book that's going to be published sometime next year. It's called Optimal Aging. We have a chapter on osteoporosis. So the integrative approach is combination of multiple parallel treatments. So it's a diet modification, some kind of an anti-inflammatory approach with significant increase in soy and also several other nutrients. Exercise, of course, self-explanatory. Quite interesting that out of all kinds of exercise prevention programs, only a very specific, comprehensive full programs in Tai Chi seems to kind of win the race. We used to think that straight weight training was essential. Turns out it is not. Tai Chi turns out to be way more important. It's not very clear exactly how it works, but it seems like there's a lot of evidence for that. Fish oil supplements, vitamin D, improved intake of protein, specifically soy isoflavones, anti-inflammatory herbs, and of course, lots of minerals, which we'll cover in a separate slide in a couple of minutes. So those are all very important. If there is a deficiency in a particular hormone, that's a lot more medical, and I'm not going to discuss this. That's often needs to be addressed. Of course, in women with osteoporosis, recommending estrogens used to be and still is part of the standard of care, although it's not without its problems. Strontium is a fascinating molecule that I do use periodically in some of my patients. It does have a black box warning in Europe because of the increased risk of heart disease. However, that's with strontium renolate, which we don't have in America. In America, we have strontium citrate or strontium, organic forms of strontium, which are not being necessarily linked to the risk of cardiovascular disease, especially also since the dose is significantly lower. So I do periodically use this product. It's very effective, and the evidence on that is really good. And the last, probably the biggest and the most recent addition to this already a pretty complex treatment plan is the vibration plates. And the vibration plates, we're going to talk separately a little bit, and I'll show you kind of how I think about it, and also some quite specifics about the vibration plates. So I'm going to cover more in detail specific vitamins and specific minerals. So vitamin D, of course, self-explanatory. You really don't necessarily want to take a dose for osteoporosis, you really have to get your level normalized. So if you're deficient, you should treat that. But other than that, it's very unclear as to exactly how much vitamin D should be taken. Vitamin D is essential in absorption of calcium. So calcium will be a whole separate conversation at the end of this slide. Vitamin C is very essential for collagen linking, and so it's critical that some vitamin C is included in daily intake. That's actually one of the biggest concerns that I have with the common calcium and magnesium formulations. They often don't contain other minerals, and they don't contain vitamin C, which is, again, essential when collagen is formed, and also bone collagen. Zinc enhances calcium absorption. Zinc is also actually does play into the processing of calcium and also in how the bone laid out. So excess will negatively impact zinc because it will block the copper, and copper deficiency blocks the normal collagen production and normal bone formation. So the zinc and copper should be taken together. And I prefer the ratio of 20:1, so 20 of zinc, 1 of copper. And usually the dose is something like 20 milligrams of zinc and 1 milligram of copper in the multivitamins. Copper is also a little bit of concern. And if you see it on the slide, it says that there's increased risk of Alzheimer's with excess of copper. It's unlikely you're going to have an excess of copper when you have a 20:1 ratio of zinc to copper. Magnesium is critical. It actually is part of the bone formation as well. So magnesium deficiency has been linked to increase in risk in osteoporosis. So it's essential. Manganese, the role is not necessarily clear, and excessive manganese can be concerning. It has been documented cases of overdose, so you have to be careful. Now, vitamin K. Now I'm gonna actually cover that in a little bit on its own accord, because actually the vitamin K is really critical. And so we're going to talk about this in upcoming slide separately. Omega-3s, not necessarily that they are directly participating in anything bone related, but they are enhancing calcium absorption, and they do have a role in stimulation of bone formation. And it's generally recommended that if you're not on a Mediterranean diet or on a diet that has enough omega-3, that you supplement. Of course, omega-3 has other roles too. And then the soy isoflavones, we're going to talk about. It's a whole separate topic too. So before we go to the more specifics of calcium, magnesium, minerals, and a couple other very specific vitamins, I want to cover this topic. So we have to get people off of the proton pump inhibitors. So those are the drugs like Nexium, Protonix, omeprazole. The problem with these drugs is that they actually increase risk of osteoporosis and they increase risk of fractures. They're often given for years, and patients often do not stop them because they're sort of told, oh, this is safe to take. Turns out that they're actually very concerning drugs, tons of side effects. Single pill of Protonix, for example, immediately changes microbiome and changes immune system. So if you can avoid them, you should avoid them. There's no question about that, not even for a second. Problem is that getting off of these pills is a little tricky. So I would say, you need to work with someone if you're taking this, but if you already have osteoporosis, you should really seriously think about getting off of this. So there's a whole information how to do that. So this is one example. I'm not going to cover it. It's in the book, in the chapter on healthy gut, if you want to look at it. But we use a kind of a slimy plant-based extracts or actual foods. So okra is a good example. Aloe juice could be another good example. And then licorice or deglycyrrhizinated, never can say this, DGL, licorice without active ingredient that increases blood pressure can be also very effective. Use that a lot. Okay, so let's talk about specific supplements. So first of all, multivitamins. All of the multivitamins that somebody with osteopenia, osteoporosis is taking should contain ideally calcium, magnesium, boron, silica, zinc, and copper in a balanced form. One critical aspect of calcium is that you don't want to take more than 400 milligrams of calcium in any one sitting. What that means is that your calcium intake should be spread out throughout the day. You want to take maybe 400 to 500 milligrams. 500, I would probably not even take 500. So 300 to 400 milligrams 2 or 3 times a day. That would be the typical recommendation. Magnesium, quite variable, probably depends on individual need for magnesium. I tend to like the products that have also split magnesium doses. And I'll actually gonna, after I run through the slides, I will be doing some, I'll show you some of the products that I like, not on the slide, but just like specifically just on the internet. Boron, silica, zinc, and copper, I kind of mentioned them. So let's move to vitamin K2. So actually both vitamin K1, which is a clotting, important in clotting, and vitamin K2, which is important in muscles and bones, have bone supportive role. Just like vitamin D, vitamin K deficiency will profoundly negatively impact bone. And it's important to know that supplementing with K2 seems to have a pretty strong evidence at improving bone density. I even have a case I'll show you in a little bit with an actual numbers, but what I tend to prefer is what's more evidence, which is MK4. However, the evidence for MK7 is rapidly gaining popularity. MK7 is cheaper and MK7 is easier to obtain. So if you're already taking MK7, I don't really necessarily think you have to switch to MK4. But the dose of MK7 will need to be in hundreds of milligrams. Quite often, the dose is not high enough. I often will get up to 300-400 milligrams of MK7 or even more. Again, vitamin D, depending on your level, probably 40 to 60 is where I would like to see most of my patients, even with those with osteoporosis. Now, soy extracts, a little controversial, but still worth discussing. So soy extracts are actually not so easy to get on the internet or on to buy, because the problem is there's a concern, or there was a concern that somehow soy extracts and soy foods can increase risk of breast cancer. I think that's really not substantiated by evidence. Plus, I believe that when the high quality company is making specific soy extracts, they tend to really improve the quality. They start with organic foods. The actual active ingredients of those extracts are probably, if anything, anti-breast cancer. So I don't personally have a lot of concerns there. And then, of course, anti-inflammatory support, because again, one of the critical aspects of osteoporosis in most of the patients, osteoporosis will be linked to some pre-existing inflammatory condition, and it's really important to treat it. In fact, I find it routinely being the biggest problem within the chronology of with a specialty that treats osteoporosis. They often do not address underlying inflammatory factors at all. They'll simply prescribe medications, calcium, magnesium, vitamin D, but they really will not look into figuring out, well, does this patient actually have particular risk or particular reason? Now, they often would look for hormonal risks, like, for example, if the woman, for whatever reason, had lost her ovaries in young age, then the risk, since the estrogen production decreases, then there would be a higher risk of osteoporosis early. So that would be addressed. But inflammation is often completely ignored and not missed. And in my estimate, at least half of all the patients with osteoporosis actually have it secondary to a chronic inflammatory response of some sort. So I'm going to show you a case and talk a little bit more about K2. So the reason I like to use MK4 is because some years ago, it's over 10 years ago, there was a series of very good studies, and most of them actually not in US, showing a pretty significant impacts on of this product. So bottom line, what you're seeing here is that this patient who came to see me was already taking some calcium, and she was doing pretty well. Actually, if you kind of look at the trend, what you're looking at here is this T-score in the red box. Femoral neck is and a total hip, which, those are the areas that if someone fractures, then of course you often need a surgery, and that's a very big problem. So this woman for a long time had an osteoporosis, osteopenia, and then osteoporosis. And osteopenia was for a long time, osteoporosis recently. Osteoporosis defined as minus 2.5 or less. And but she was relatively steady. It's not necessarily clear what happened here, but this is where we added an extra dose of K2, and just in a span of about 2 years, there was an immediate improvement and a complete stability. So this is something that we see on a regular basis. K2, sometimes when you give it in a very high dose, like in this case, it itself can be quite beneficial. Unfortunately, K2 at this dose will cost somewhere upwards of $50 a month, so it's not necessarily a cheap product. So I'll come back to actually what I'm going to do is this. I'm going to show you and talk a little bit about vibration plates, and then I'm going to go to specific products and just going to kind of show you how I organize these things on the internet real briefly. And by the way, the links to a couple of my favorite products, few of my favorite vitamins, as well as the vibration plates that we recommend, will be in a link to this YouTube video. So why vibration plates? Well, I don't know how and who initially thought of starting to do research looking into can vibration at high frequency help the bone formation and prevent or even reverse osteoporosis, but turned out it does. About 10 years ago, the data was a bit controversial. Recent studies have been more positive, and the reason for that is that it's very clear that if you're going to use vibration plate, you would want to use something that has at the minimum 25 or 30 hertz, and ideally a 40 hertz frequency. It turns out that the higher frequency is what actually makes the bone formation much more significant, and the lower frequency really not necessarily effective at all. So you're probably better off just doing a regular exercise instead of doing vibration. You would use it for about 20-30 minutes per day. If you just go on Amazon, you will find hundreds, if not thousands, versions. So they are quite variable in price. This is a mid-range price, the one that I'm showing you, and this is the one also partially why I recommend this type of plate. And again, you can find specific products in the link. And the reason is that, first of all, these plates get all to 40 hertz. They do have the way to hold on to something. So you see there's this bars going up. So this is actually quite something important. If you're going to buy the plate that has nothing to grab onto, you have to make sure that you either install the grab bar on the wall next to where you're going to use it, or at least have some kind of a system in place where you can stabilize yourself if you start losing balance because of vibration itself. The plates are quite small usually, so you see it doesn't take a lot of space. You can fit it in your room. Many of them would be compactly foldable or turned to the side so that it takes even less space when you're not in use. I often have my patients just tell them, when you do it when you're working, if you have a standing desk, great. If you have sitting desk, fine. Just put your feet on it, and you don't even have to fully stand on it. It will still have some partial benefit. So very easy to use, may not even lose any time at all. You can even use it during your working hours. You just turn it on, 30 minutes. Now that's not instead of physical exercise. Just want to make sure that everybody understand that. That's in addition to. If you replace exercise with vibration plate, I'd say that I've done you harm by looking at the video. So no, absolutely, it's the opposite. It's an unfortunately additional 20-30 minutes per day. But when they start working, the benefit is pretty obvious. Again, I think that the total number of these devices is such robust right now that all patients trying probably all kinds of different plates. I will tell you one critical aspect about the plate is make sure that when you look for it, that the motor's warranty is very good, and that and then you won't need to pay shipping when motor burns out for replacement, because these plates are generally very heavy and the shipment can be quite expensive. So you want to make sure you have a 10-year or so very good warranty. You want, or even the replacement of the whole unit at no cost. That would be the best, of course. That does cost usually more, so that comes with a higher price. There are some plates that can get up to 40 hertz that are going to cost close to $100. I don't recommend those. I can't quite see how that is possible physically to make such a low cost product that this that's good enough. So this plate I think is about $300 or $400, the one you're seeing it here, and that's a typical price. Okay, and then I promised you that I will show you a couple of products. What I'm going to do is I'm going to come to my well-awaited page, and I hope it's going to work. Okay, so I'm going to log in here. And slow. Apologize about that. Basically, what I'm trying to show you here is just the way I think and formulate this product. And if you're my patient already, you're probably already seeing this. But so I'm going to just make a recommendation to, I don't know, to test. I think I have a, do I have a test patient? No, I don't. Okay, let me pick myself. I hope I'm in there. No. Okay. Pick somebody. Okay, we're not. Okay, okay. So this is my brother. I'm just going to use him as a patient model here. So I have a preset protocol that I'm going to show you. There actually have lots of different protocols here, but I'm just going to show you one. I even have several different osteoporosis protocols. So I'm just going to show you one. So one product at a time. So this is one of the more commonly used multivitamins that I like to use, Osteoprime Ultra. By the way, for full disclosure, I don't have any particular financial relationships with any of this supplement companies, just like using their product. So you can see that this is a full multivitamin. You have 800 milligrams of calcium, and this would be taken in 2 tablets twice a day. So you'll be taking 400 milligrams twice a day. With that, you will have low dose vitamin D. There's only 20 micrograms, so this is 800 units. So it's a pretty low dose, but you will be taking 400 units to enhance absorption of calcium, to just make sure that the calcium is absorbed well. Now, this does have K2 in the dose of in the MK7, menaquinone 7. The amount is pretty small though. So you will see me typically in most of my patients give additional K2. And the main reason for that is that I always try to get over 100 and preferably 2 or even 300 of MK7, or 15 to 30 or even 45 milligrams of MK4. MK4 comes in milligrams, MK7 comes in micrograms, an important distinction. So that's first one. So let's look at others. So the soy extracts now is okay. I often also use Life Extension. It's important to get at least 100 milligrams a day. I don't know what, this is not working, but hopefully we'll get some. I don't know, there's a glitch here. So I'm gonna go back. Strontium is, again, I'm not gonna necessarily discuss this right now because, as I mentioned, it's not for everybody, but usually this is the product I like to use. I use 1 or 2 capsules a day. It's a 227 milligrams in this particular formulation, but actually sometimes the capsules will have 300 milligrams. I don't think it makes a big difference. And then the last product, this is the capsules of K2. K2 also comes in drops from several companies. Thorne is a one that I often use, but capsules more preferred for most patients. And this is the 1 or 2 capsules a day. So, and with this, I'm gonna stop sharing, and I think I'm gonna end this. I probably missed a few things. You may ask me for you know, and you can comment in the video, and I'll see if I can put in additional comments to questions. So thank you very much. Until soon, and let us know if you like this format. We are probably going to do more of this type of, oh, I knew I forgot something before I let everybody go. Let me show you the website for the vibration plate. You can get them from Amazon too, by the way, and often that is the easiest thing to do. But if you use the direct order from this company, you'll get 5% discount. We just signed up to get the special promotion code for all of our patients. So this is the vibration therapeutic. They have a couple of different machines. So they have the one where you have these bands to hold on to, which is to stabilize yourself. You also have systems that kind of softer and then also a little bit harder and a little bit different in price. We don't recommend this one. So it's choices between these two platforms or plates. And, you know, and they all go up to this ones, the 3 and 7, they go up to 40 Hertz. And this is really important. And I think that's pretty much it. If you have any questions, as I said, drop them in the question place, and until soon, bye.